Dr. Porzio, what is a concussion or a traumatic brain injury?
Concussion is on the spectrum of traumatic brain injury. Traumatic brain injury really represents injuries that go from intracranial hemorrhage to more functional or cognitive injuries like concussion. Concussion has become synonymous with that form of traumatic brain injury.
What are the causes of a traumatic brain injury?
Traumatic brain injury is typically caused by a direct blow to the head, but it can also be caused by a blow to the neck or torso that causes an impulsive force to be directed at the skull and head such that it moves violently back and forth. This is an acceleration-deceleration injury, and it literally causes your brain to rattle in your skull.
What are the symptoms of a traumatic brain injury?
At Mark Urgent Care, we have a concussion recovery program we call Headstrong. In that program, we screen patients for 22 symptoms that range from headache to neck pain, dizziness, drowsiness, insomnia, confusion, poor concentration, any number of symptoms, nausea, vomiting, emotional irritability are just some of the symptoms of concussion. In our program, those 22 symptoms are graded on a scale of 0 to 6 on all those symptoms. It is the really subjective nature of these symptoms that makes concussion so very challenging.
How do you diagnose a concussion?
TBI and concussion are both very difficult to diagnose. It is a clinical diagnosis that requires an injury, a symptomatic patient, and something on objective testing, whether it be cognitive balance or other forms of testing. And what I mean by that, in our Headstrong concussion and evaluation program, we use something called BrainScope 1. This is the latest EEG technology that allows us to perform an EEG and neurocognitive testing on a patient and determine if there's structural injury, functional injury, and or impairment on their cognitive testing. We then can combine this with our assessment, the physician's assessment, the patient's clinical symptoms and the injury, mechanism of injury, and come up with a confident diagnosis of concussion in more than 90% of the patients, certainly.
How do you treat a traumatic brain injury?
Many patients benefit from treatment with physical therapy for their concussion. This includes treatment of their musculoskeletal injuries, as well as treatment of vestibular symptoms to aid in any balance problems that they have. For patients that have the post-concussion syndrome, they sometimes require specialized neurocognitive testing, and in those instances you often will do imaging, but by and large you don't need imaging in the treatment or diagnosis of a concussed patient.
Are there long-term health issues if a traumatic brain injury is not properly treated?
Well, the simple answer to that is we don't know. We certainly know that patients need to be recovered progressively into full recovery to prevent what's called the second impact syndrome, and that's where a patient suffers a second concussion before the first concussion is fully recovered, and then they can, in those instances, they can actually suffer acute brain swelling and even death. But in terms of the long-term sequelae, we really don't know. We know that concussion causes chronic traumatic encephalopathy. What we don't know is which patients that suffer concussion that get chronic traumatic encephalopathy will actually manifest clinical symptoms of it, which really essentially become dementia and or depressive disorders and anxiety and so forth. But all we know is that there is definitely pathology there in these patients when they're getting their heads repetitively struck. What we don't know is how many times they need to be struck and whether or not being struck is enough, or what other factors cause the patient to really develop the clinical manifestations of the disease.